Hey, Colin here, and welcome to the Patient Attraction Podcast. Now, you might have heard that having video on your website is more effective than just having written content alone. But there are different types of video, and one type in particular can actually scare away potential patients that want to appoint. Don't get caught with these kinds of videos on your website unless you do them the right way. Now, back in 2014, I spelled out 4 ways for dentists to use and improve what I call explainer videos. Enjoy this classic podcast, and be sure to come back tomorrow for part 1 of a special 4-part series on appointing more patients. Until then, keep moving forward. Dentists using video on their websites are getting great results. Patient testimonials are the most effective way to get potential patients to trust you that you can solve their problems. But as I mentioned yesterday, putting you on camera also yields big dividends. I'm going to tell you one way to do that when we return. I'm Colin Receiver here on Wednesday, December 3rd. And here at SmartBox, we've made a name for ourselves providing phenomenal video as part of our marketing systems. Not only is the quality of the video much better than any of our competition, but we've always been ahead of the curve in terms of content, because video done well is so effective. I've talked many times about the benefits of video, so I'm not going to go into all of that again. But today I do want to talk about one type of video that is overused, and not just overused, but done poorly and overused, and that's explainer videos. In some industries, an explainer video is used to demonstrate and explain a product. In dentistry, this is a video that explains a procedure or a service, or tells you about how something works, how an implant goes in, or how you prep a crown for veneers. Some of them are graphically and visually done very, very well, very appealing. They talk a lot about how an implant works and clinically how it functions and how those veneers go on your teeth. And they give people the dentistry information that a dentist thinks a patient wants. Unfortunately, with those kind of explainer videos, it's the wrong kind of information that you're delivering to a prospect. Video is something that should make a patient connect with you. It should build you up as the expert, show the patient you're compassionate, show them that you're the expert, you're the guy to take care of their needs. Very rarely, less than 5% of the time, our research shows, does a patient ever want to know how a procedure works. The first things that they want to know is it going to hurt? Is he going to charge me a fair price? And is he going to do the work correctly? In explaining how a procedure works, clinically how an implant or how veneers or how a crown or how a filling or how Invisalign works, is that going to happen? Video needs to set you up as the guy they need to talk to. And when they come into your office, they may have some clinical questions here and there. But your website is a marketing tool, and it needs to take people from where they are now and convert them into a prospect sitting in front of you. Their questions may change at that point, but if you don't give them the information that they want here, they're not going to make a decision based on a clinical video on your website. It's not making you the guy they want to call. Educating them on how an implant goes in the jaw is only going to scare them off if they're a patient that is fearful. Look at the demographics of what patients want, what kind of information they want, and why their mouth is in the shape that it's in. A lot of implant patients have avoided the dentist for 20 or 30 years out of fear, out of that past bad dental experience they have. And as a result of avoiding the dentist for 20 or 30 years, now their mouth is in the shape it's in. Fear is the number one reason people do not come and see the dentist. And do you really think a video showing you removing their teeth to put dentures in, or cutting away gum tissue, or putting an implant into the jaw, even if it's a graphical illustration and not an actual video, is going to encourage that prospect to come in and talk about the procedure? No way. So why are these videos so pervasive throughout the industry? Because dentists lose sight of tip number 2. You're making videos for the patients, not for other dentists. I've joked many times that most dental marketing is more attuned to attracting other dentists than it is to attracting patients. You have to address the needs of your patients, not your need to show off your handiwork. All of your videos should come from a standpoint of addressing patients' needs, not your services. That means when you're explaining how your CEREC machine works, how you can make a crown the same day, you don't talk about the machine. You talk about how patients don't have to wait for weeks for a new crown and how it can be made while they wait. And there's no temporaries even used. There's no temporaries at all because we do it the same day. Because everybody's had a bad experience with temporaries. Third, use a video to humanize yourself and your staff. Tell prospects why you got into dentistry. If you had braces when you were a kid, that's relatable. If you had a grandparents lose all her teeth and she walked around, and I remember my grandpa, he had his teeth in his pocket. That's relatable. If you got into dentistry because of your childhood dentist did a great job, and that's what you wanted to provide, that's the experience that you wanted to give to other people, that's relatable. People want a dentist who is relatable. Finally, keep your videos short and to the point. It's better to have 10 2-minute videos than 2 10-minute videos. People have short attention spans and many demands on their time. Stick to one succinct message and you'll get much better viewership and results. Thanks for watching and keep moving forward.